I think we all have to start talking about healthcare, and we all have to say, and we also have to start having conversations again about taking out ideology. Let's not talk about I've always voted conservative or always voted NDP or whatever. It's like, is our healthcare going in the right direction? Is it going the way that we think we want for us and our loved ones? And start having that conversation, but then start saying, if I'm concerned it isn't, then we have to start getting active and mobilized and start talking to our MLAs and start talking to our government, because they're the only ones that, it always seems partisan to criticize what the healthcare system's in right now, but there's only one government that runs it ever, right? So we need people to add their voices to this, because I want to say, I haven't touched, like for our community, where you're going to see troubles are, if we don't do a really, coordinated workforce planning, capacity planning, we hear of Bow Island's lost their emerge docs all the time, and Bow Island closes. We're gonna get to where we might hear Brooks is closing, and Brooks emerge might not be staffed anymore, or Oyen, might not be able to get staff in it anymore, and these communities that feed into our community, and that's a double whammy, because then anybody living around here, when you lose your hospital or your emerge access, and you don't know what you got till it's gone.
Yep.
And then once it's gone, it's almost impossible to replace. It's really hard to recruit nurses and doctors into a hospital that hasn't been functioning, for example, or a community that doesn't have support. So once you lose it, you're in danger of losing it for a long, long time or forever. But the second is then that impacts the communities around you, because all of a sudden, the only places you can go is Medicine Hat. So in our community, so when Bow Island's closed, if Brooks went down, if others around, everybody's got to come here. And again, that just adds more volume and more complexity and more weights for everybody in one center. And that's not what we want. Everybody should have. I think as a society, we should start to prioritize and say, here's some of the minimum things we should have, that we should think you should have in reasonable sized communities, and we should protect that. Like, for example, in the Hat, we had a couple months ago in the last year where we had no obstetrical coverage in our entire, so in no obstetricians in our hospital to be able to deliver babies for the sick and complex. We had family docs that could, but our obstetrical specialists weren't here. But that's kind of mind-blowing, because that's not just for the Hat, that's for the entire surrounding area. And that means young, healthy women who may have complicated pregnancies, like twins or things that we know are going to be complicated. They got to travel all the way to Calgary to deliver their babies, as an example, and you don't know when they're coming. Like, it's those are the problems we got to deal with.
And Calgary might not have the room either.
Well, in this state where we are right now, absolutely not. They're going to struggle. It's going to be tough.